Hi, my name is Amaris Somran. I'm going to be performing the Colostomy Care video submission for Nightingale College. My tools today consist of my Nightingale uniform and badge, my washcloths, my 2 pairs of gloves, my stoma guide, my ostomy kit, scissors, sanitizer for hand hygiene, and my basin. So I'm going to start off by entering the room, providing privacy, introducing myself, verifying the patient's name and date of birth against their wristband, and then explaining the procedure to the patient. Okay, so I've entered the room, I've provided privacy. Hi, my name is Amaris. I'm going to be your nurse today. Today we're going to be changing your colostomy bag. Can I have you verify your name and your date of birth? Okay, perfect. I've checked that against her wristband and it is correct. So like I said, we're going to be changing your colostomy bag today. That just means I'm going to remove your current ostomy bag, clean the stoma site, assess the site, and then replace it with a new bag. So I'm going to start off by asking if you have any questions or concerns. Okay, the patient has no questions or concerns. I'm going to perform hand hygiene. And then I'm going to put gloves on. Okay, so I'm going to first remove the ostomy pouch. And I'm going to empty the contents into this basin. Okay, so we're emptying out the contents. We're going to save that. And then I am going to carefully remove the wafer, pulling away from the skin gently so we don't cause any damage to the stoma. Now I'm going to clean the stoma with warm water and water-based soap. So we're going to clean around. While we clean, we're going to assess the site for any breakdown in tissue integrity or skin integrity, making sure that the stoma is beefy red. If it were not to be beefy red, then we would have to notify the provider. Then I'm going to use a dry washcloth and dry the area. So I'm going to remove my gloves and perform hand hygiene. And I'm going to place new gloves on. My hands are sweaty. Okay, so now that the gloves are on, I'm going to measure out I'm going to use the stoma guide to measure out the wafer. So we're going to place it against the stoma and see which one fits the best. We don't want it too small or too loose. And then we're going to measure it against our wafer. I'm going to be using the 28mm hole. We're going to apply a skin barrier to protect the skin integrity. And then we're going to place the wafer onto the stoma and push out to make sure that it's stuck on there correctly. And then we're going to place the pouch. Okay, and we hear the click. I'm going to roll the bottom here and secure it so that the contents don't spill out. And then I'm going to remove my gloves, perform hand hygiene. Do you have any questions or concerns about your new stoma, your new ostomy bag? Okay, patient has no questions or concerns. I am going to make sure that the patient is in a comfortable position and perform hand hygiene again. And then I'm going to document the procedure and notify the provider of any concerns. Okay, thank you for allowing me to change your ostomy bag. Okay.